Hi there, I would like to spend some time to discuss medical evacuations. You want to have this checklist essentially to ensure that you do not miss any one of these steps because every one of them is critical. So, the travel warrant being the first thing, Medevac abstract is the second thing, the Medevac record binder, the progress notes, diagnostic results, such as ECG, X rays, labs, and so on, that may be pertinent to your case. And finally, the referral letter. Now, there are several pathways to evacuating clients from the community, depending on their stability and depending on the needs that they have. If I may highlight quickly, your stable patients who may have what we call the SCEDEVAC, aka scheduled evacuations. So I'm referring to patients who are stable, they have stable fractures that we can immobilize and then evacuate them in commercial airliners the following day, or patients who are more unstable and they are to be seen on a follow-up. We can place them in scheduled evacuation. So the travel team locally to the community will be able to make the arrangements for the travel. Essentially, what they will be requiring is the referral letter. They will be requiring the progress notes and the very plan where this client is going, who will be receiving them there, who's the provider to see them there, how long they have to be gone for, and so on. They have a whole checklist that they go through to ensure that the client obtains the services they need on a scheduled evacuation. On the other hand, we have some unstable patients for whom at times we obtain a receiving physician at destination. Typically, if you're traveling from Cross Lake, a lot of these receiving physicians are at Thompson. So the MRP in Cross Lake would call Thompson and have a doctor-to-doctor conversation referral. And once we have secured a receiving physician, then what will happen is the MRP will provide the RN instructions to arrange transportation. So we would then call Vector to provide to them the details of the case and tell them that we have a receiving physician. Let's say Dr. X in Thompson will be receiving the patient. So Vector will then work alongside with MTCC to arrange transportation based on the needs of this client to get them to Thompson. The rest of the workflow and the requirements will be similar to those who are being medically evacuated in an emergency contact. So let's take the example of Mr. Sam, a 58-year-old patient who is essentially presenting to our nursing station, let's say in a context of chest pain. Right? So Mr. Sam comes in with chest pain, and based on the troponin and the ECG, we identify that he has himself a STEMI. Okay, so we consult right away Vector, right? Because this is going to be an emergent or an urgent consultation. Who can make this consultation? RNs are delegated providers, and they can call directly Vector to provide this information. So what the heck is the point of calling Vector here is we have identified this is a STEMI. We do not have a cath lab in the community, and the needs of this client exceed what we are able to provide in the community. So essentially what's going to be following is that we will call Vector at their phone number highlighted right here, and what they will be requiring of us is this information. So number one of this information is they want to know who is the caller. So I will tell them, hey, my name is Justin, I'm a registered nurse, and I am calling from Cross Lake. They will require a callback phone number, to which I will give them the nursing station's phone number. Who is the referring provider? And the callback number. So if you are working with a physician or a physician assistant who has made the referral, who's requested that we call Vector, I'll provide them the name of the doctor, Dr. Ward, who's requested that we call to refer this case. If it's a physician assistant, they will be requiring the name of the supervising physician in-house. If there's no physician in-house, then there is no physician in-house. They will inquire about the emergency or the acuity of the case. They will be requiring, if it's a specialty services consultation that will require, then they will be requiring that information. Orthosurgery, trauma surgery, pediatrics, and you name it, right? And then we need to have handy with us the patient information, their name, their FIN, their date of birth, their weight, right? And we will be also requiring, they will also be requiring the information about the pickup location. So that will be Cross Lake Nursing Station. If we already know the destination, as we stated in the previous case, they're going to Thompson, then we'll provide. If we don't have a destination and we're looking for them to consult and to help in identifying the most appropriate destination, then they will provide that support. They will need the treaty number, the warrant number. This piece of information will be on the travel warrant. The travel warrant is a carbon paper booklet. You're going to find it on the nursing station on the desk. More precisely, it's kept in the Medevac binder. So you're going to have the travel warrant book. You're also going to have in there brand new, you're going to find in that very same binder Medevac abstracts like this one. I will break it down for you here very shortly how to complete that. All right, so they will need that travel warrant number. They will need also to know if there is any special equipment that is required, so IV pumps, or a respirator, or whatever that could be. If there is any isolation requirement, let's say we're dealing with an influenza case, and then the information about the escort. Very, very important. We need to know the escort and their weight, right? All minors have to be escorted. All patients who are unstable may request. Remember, there is only a limit to one escort. However, in collaboration with the nurse in charge, as well as the transporter, sometimes they have been able to take more than one escort, but generally speaking, there's only one escort allowed. At the end of this conversation with Vector, it's very important that you make sure they have obtained from you the warrant number, and you must obtain from them the authorization number. This is critical because it's going to be necessary for when we're doing the abstract. Okay, the steps that are going to follow thereafter is MTCC is going to be involved. MTCC, essentially all they do is they arrange the transportations. So, and whenever we need ETA or updates on when our transporter is coming in, MTCC will be our point of contact. Essentially, after we finish the phone call with Vector, then we will get in touch with whoever is going to be the transporter or our consultant, who will call us thereafter to get a report on the case and to do the triage and everything else that follows. So we have been getting updates from the MTCC. We know our transporter is on the way. When they arrive, usually what they will do is they will do a reassessment of the patient at bedside. Okay? They will make sure there is good vascular access. They will make sure the airway is secure. And then as far as the documentation that they will be requiring from us, they will need a copy of our progress note. So photocopy your progress note. They will need the first page of the warrant. Remember, I pointed out it was a carbon paper, so they will need the top paper. If we have any ECGs or any other diagnostics, please add it to the pile, and any extras. To the extras, what comes to mind here is going to be the problems list. Right? And if there is any clear instructions from the patient's chart, add it to the pile. The problems list is going to be a yellow ribboned paper. That is the first page of the paper charts. Please make a copy of that. Essentially what it will have is all the past medical history. It will also have any immunization history. It will have surgical history and so on and so forth. The other piece of documentation that may be good to add here is, if you have it, the medications list for the patient. Okay, so make photocopies of this pile, and that is to be provided to the transporter when they arrive. Let's go back to our checklist here. So travel warrant, we have discussed that, right? The carbon paper here, that they will be getting that first page, and the travel warrant number will be a number that we'll provide to Vector during that initial conversation. The Medevac abstract, I will be discussing that very shortly, is the last bit. right? The Medevac record binder page. This is very, very important. This is how we keep track of Medevacs, all right? So in that, on that page, it's going to be in the Medevac binder. Essentially, we'll put patient's information, reason for Medevac, right? And obviously the dates and times is very critical, right? We need to document the Medevacs in there because that is how we keep track of data. Not only that, I think it does play a role also in funding and keeping a record. Progress notes, as we pointed out, we'll need a copy of that. And please ensure that we also mention in our progress notes, we include all the meds that have been given, right? All the workups, right, that have been done, any complications, okay? More or less, let's support the receiving team so that they have everything that they need to do the continuation of care. Diagnostics, as we pointed out, here we want to ensure ECGs, X-rays, right? CDs of any other diagnostics that we may have handy, labs, right? Labs results. Because again, our point of care does not necessarily feed into any electronic system. So they will need access to our urine analysis, our initial hemoglobin, white count, and so on and so forth. For those patients who are being sent to places like Thompson, where we have a receiving doctor, even those patients who are going on scheduled evacuations, generally speaking, there is a preference to have a referral letter put together by the MRP, ensuring relaying the reason for this medical evacuation, the needed investigations, management, and so on and so forth. Now, to conclude this little revision here, I would like to go over a Medevac abstract form, okay? So we are sending away our patient. His name is Mr. Sam. He's 58. His treaty number is 4545, and he's going being transferred because of a STEMI. Let's say he is going to Thompson, okay? So what are the expectations when you fill the Medevac abstract? So the referring community, let's assume we're in Cross Lake. So I will put here Cross Lake. All right. The client's name is Mr. Sam. So Sam, and let's call him Tim. All right. The date this is happening, let's say it is for nursing station admission. Let's say they were admitted today, which is the 28th of April. All right, 2025, and they got to us at 11 a.m. Right, we called Medevac, let's say at 11:30. All right, and the original ETA we were given was 12:15. Right, and all of this is happening on the same date, 2025, 28th of April, 2025. Wonderful. Now, this is a gentleman, and his date of birth is 58. Oh my gosh. Let's make this 1958 just for the sake of numbers. Let's give him February the 1st, right? And here is where we're going to put his treaty number, which is 4545. His FIN number, let's say it's 1234567, and his MHSC number, let's say is 3333, right? He was referred by Dr. Ward, right? And this is a physician. We don't have the information about the airline yet. The consultation, let's say Thompson, right? And referred to Thompson GH, right? Accepting physician, Dr. Mallard, right? The reason for the referral, the patient is going because of a STEMI, all right? And they were a CETA score number 2 for us. We don't have any information, prenatal, newborns, and gestational weight, and so on, because that's not the case we're dealing with. All right. Is there any surveillance, infectious disease, injury, poisoning, pregnancy, chronic disease, mental health, and so on? It's a no. Is there any injury, poisoning? Is a no. Any accidents or traumas? No. In this case, so what you will need to do then, if it's a no to all of those questions, you can bar it, this entire page, because the abstract has to be fully completed. All right, and we have identified that the escort will be Mr. Sam's wife, Sandra. So we'll write Sandra Tim, right? And the reason the escort is needed, we're going to specify medical. If this was a minor, then we would specify the patient is a minor. All right. And the name of other patients transported on this Medevac charter, no, we're not sending anybody else. And this form was completed by the registered nurse. It's critical that I put my signature. And again, today is the 28th of April, 2026. All right. So now, once the information start trickling in about the arrival of the Medevac, then we'll put the information that, hey, they will be going by the airliner. Let's say Fritz is the name of the airliner, medical, that will be coming to pick them up. Okay. Now, when the Medevac arrives, then we're going to come back to the abstract and specify that the Medevac actually arrived a little bit earlier, if they did, right? 28th of April, 2026. And I realize I'm writing the dates wrong. I should put the year first, but you get the point. And then we'll document what time the Medevac actually leaves, right? 2025. And they leave, let's say they leave our nursing station at 12:45. Now, at the end, once this is all completed, I'll make sure that this information is reflected in my progress notes as well. So the times Medevac arrived, what time they left, the condition of the client when they were leaving, the last vital signs, and so on. I'll make sure that information is in my progress note. And notice here, there is a fax number, right? It will tell you on completion, fax it here. In the big printer in the nursing station, you will see these numbers already pre-programmed. If the patient is going to Thompson, there will be a pre-programmed fax for Thompson. If they are going to Winnipeg, it will be very precise. You will send it to Winnipeg. The reason why this Medevac abstract information has to be very accurately completed and on time and faxed is because this is a documentation that's going to support delivery of services to the client and the escort at destination. So they may not get residence, they may not get meals, and so on if this documentation is not properly completed. So it's critical. You must ensure this form is properly completed and faxed. My practice is that I will actually attach a copy of the confirmation of the fax to my abstract when I return the completed abstract into the Medevac binder. All right, so I'm hoping that covers everything that you need to know about Medevac. Remember this very checklist. So travel warrant, right? The Medevac abstract, the Medevac record binder where we have to enter the information of the about the Medevac, the progress note, which must be sent with the team, the diagnostic results that we have, and the end, any referral letter. Again, 3 types of evacuation of the clients: scheduled evacuations for more of your stable patients, which will be arranged by the travel team in the nursing station. You're going to have the emergency Medevacs. Either they're going directly to a receiving physician, in which case we are Vector is just going to support us in making the arrangements for travel. But for the critical unstable patients, Vector is again our point of contact for consultation. So they will get us in touch with orthosurgery, peds. They'll get us in touch with trauma surgery. They will get us in touch with cardiology, GI, and so on. And subsequently make all the other arrangements that may be required for a transporter to get these clients where they need to go. Feel free to reach out to me if you do have any question. I'll be happy to answer those. Thank you.